Hello, 3x4 community. Today, I want to share with you a resource that I believe would be beneficial for you as practitioners, and hopefully you'll share with your patients and clients. I'm talking about sphincter muscles. In a human body, there are, I believe, over 60 types of sphincter muscles. Some are internal, some are external. Their functions are some voluntary and some are involuntary, like your muscles around your eyes, your lips. There are anal sphincters. There are different types of digestive lining sphincters. And when your body is functioning at its optimum level, all these sphincter muscles contract and relax simultaneously. For example, when you exhale, your diaphragm contracts, so does the muscles around your eyes. Or remember, I'm sure as children you play this game when you look into each other's eyes without blinking, and whoever blinks first, they lose. Well, after a while, you had to blink because your body is trying to balance itself and you just couldn't not blink. And when your body goes out of balance, so does sphincter muscles. For example, if you're working with a patient that has GERD, their cardiac sphincter has either become weak or just stopped functioning. Before I get into the resource, I would like to share a little bit about myself. Just take a couple of minutes. My name is Ani Papazian, if some of you don't know me. I am a pain relief specialist. I got my bachelor's degree in Armenia, former Soviet Union, where I also studied medical massage. And fun fact, I also played volleyball for Armenian national team. And then after college with our family, we moved to United States in 1992, where I reinstated my diploma, bachelor's in kinesiology. And then my goal was to continue with my education and get my master's with either becoming physical therapist or a chiropractor. Well, that idea was very short-lived because as soon as I found out I had to dissect cadavers, I was out. So since I studied medical massage in college, which at my time, massage back home in former Soviet Union or parts of Europe was part of a mainstream medical practice. Every doctor's office had a massage therapist. Every patient had to go through medical massage treatments. So I decided to go back to and become a massage therapist. And then my passion was pain relief. So throughout the 25 years of my practice, I was very fortunate to come across some amazing out-of-the-box thinking doctors, practitioners that donated just kind of their life's work was to create some unique pain relief techniques. So I studied with them and tried to figure out as much as I can about pain relief. And then after a while, after 10, 15 years practicing specifically just medical massage, I realized that a lot of times the joint pain or muscle pain could be coming from internal organ dysfunctions like digestive issues or constipation. So I went back to school and got my nutritionist certification and then started taking a bunch of seminars, classes from Dr. Jeffrey Blunt, Dr. Datis Karaisian, the functional nutrition, blood chemistry analysis, endocrinology, functional neurology. And then one day I was listening to James Maskell, the Functional Forum, and there was Yael analyzing James's genetic test. And that got me. I knew I had to learn more about it. So right away I signed up for Translational Nutrigenomics Manuka course. And I'm hoping that I can just dive into and learn so much more about genetics and different genetic variants and their kind of contribution or their effect on pain, joint, muscle, soft tissue, connective tissue. So it's a work in progress, but my main focus is pain relief. That's all I do. If you don't have pain, I won't take you as a patient. And it's a lot of fun and I love it. So back to our resource. So the resource I'm talking about is actually, it's called The Secret of Ring Muscles, this book. It's also called Paula Method. This is an amazing book, even though it's a tiny little book, but depending where you purchase it, it comes with its DVD with the exercises. But Paula talks about how these sphincter muscles, the imbalance of sphincter muscles when some have to contract and the others have to relax simultaneously. As I mentioned, in a healthy body, they contract and relax simultaneously for the body to function properly. And when the body goes out of balance, these muscles stop contracting and relaxing where they're supposed to. And by doing the simple exercises that mentioned in this book can help your body go back to balance. I have to say an example, about 3-4 months ago, my eyes started seeing kind of like floaters. So I went to a eye doctor, of course, and he did testing and he mentioned, I can't remember the name of what he diagnosed, but in my retina, there is the gel-like substance. And he goes, there's like a little particles when gel becomes liquefies as you get older. And that's what's happening to you. So I said, okay, what's the solution? He goes, well, there is no solution. It's part of getting older. And I'm thinking, yeah, that's not happening. And his comment was, if it gets worse, then you should go see a retina specialist. And I'm about everything doing natural. So I started doing some of the exercises in this book. And I have to say, I'm about probably 70–80% better. So I continue to do them daily, simple exercises. And I would highly encourage you to check this book out. So you can get this book on Amazon. It's just the book itself about $30–40. No big deal. But and then not all the books come with the DVD, because if the DVD is involved in it, for some reason, the price jumps to like $159. I don't know why. But all of the exercises are in the book. Like, see, it shows a lot of the exercises with the hand exercises, with the lip exercises, the eye exercises. So hope you find this as helpful. Like I suggest most of my clients to get this book and to do some versions of these exercises. You don't have to do every day, but sometimes when I'm sitting or watching TV, I try to do the eye exercises, especially, or the lip exercises like that, or kissing. Anyway, I just wanted to share this resource with you. Hope you find it helpful. And if you do try and get some awesome results, please leave a comment. Thank you.